Welcome to the CounselEAR Workflow Overview tutorial. In this video, we're going to review a very typical patient workflow encounter, meaning like an adult audio. We're going to take this patient from the point of scheduling through the encounter all the way to the point of creating an invoice, submitting a claim, as well as creating their professional report and sending it out to, say, a referring physician. So we're going to go through this rather quickly. Now, I should point out that there are other tutorial videos which examine much more closely individual aspects of this workflow. So if you have questions about scheduling appointments, for example, I encourage you to review some of those videos, or specific creating professional reports. You can review videos there. So this will be a high-level overview that'll move right along from step to step, but please check out the other videos, or of course reach out to the counselor support team if you'd like additional clarification. We're going to start here in the schedule. So we're going to take, like I said, a patient calling in. We're going to create an appointment and take them through the process rather quickly. So let's say a patient called in. We'll go ahead and click on the day and time. If they are a new patient, we simply can use the quick add feature. If they're an existing patient, we can start to type in their name, right? So as we start to type, we'll see the list of patients that apply. If you have multiple locations, you'll see their preferred clinic and any alerts within the patient profile. So we're going to grab Laura's profile here. We can note, by the way, she left her sunglasses in the office and there's some concerns for memory loss. Okay, so it just alerts us to maybe information we need to know as we are scheduling this. In this case, let the patient know we have her sunglasses, right? So we're going to go ahead and schedule an appointment type. Now, of course, this would all be customized for you. This is just a sample list that we have in our Sandbox account. I'm going to go ahead and pick a referral source, same idea, that would all be customized for you. Now, of course, you can add notes at this point. You can note if a companion is coming in. You can note if a physician referral is required. This is most commonly for Medicare Part B, for traditional Medicare. You can also reserve a room. There's other features available within here as well. But we're going to go ahead and just move forward and say, all right, we have our date and time, we have the appointment type, and the patient designated. Now we'll see we have Laura's appointment there on the schedule. When I hover over the appointment, you'll see a little pop-up here. This pop-up, of course, has a lot of different points of information as well as links. You can link to the patient profile from here. You can see their contact info, appointment info. You can confirm the appointment from here. Now, of course, CounselEAR also has the ability to send out automated confirmation messages via email, text, as well as call messaging. But of course, if you, in the case of scheduling this patient only an hour or two out, you probably want to confirm directly here. Okay, or you can rely on the automated methods. There's also the ability to arrive at the patient, right? So when the patient is ready to be seen, when you click the arrival notice, it will send a pop-up message to the provider letting them know that the patient's ready to be seen. So if this is an audio and maybe it's the first time we've ever seen the patient, you may want to verify some information in their profile before you click arrive. Whereas if this is an existing patient that's coming in for a cleaning check, maybe you saw them last week for for another reason or for the fitting, you simply might click arrive when they walk in the door. So it's up to you. Okay. You can no-show, you can complete the appointment from here. You also can launch your chart note from here. You do not have to launch your chart note from here, but you absolutely can. It can be launched directly from within the patient profile as well. Okay, and we can see the other areas here. So for example, if I confirm this appointment and then hover over this, we'll see now the appointment is confirmed. Same idea if the patient had done so via the automated methods. Okay, what we're going to do is we're going to say, all right, the patient is ready to be seen. We're going to go ahead and click the arrival notice. Once again, that'll send a pop-up message to the provider letting them know that the patient's ready to be seen. Now, if you're a provider receiving that pop-up, you'll see it in the top right-hand corner of your screen. You can simply click on the patient's initials to be directed to their profile. If you click on the message, it'll bring open the chat feature where you can chat back to whoever sent that. And so you could say 5 minutes behind, right? And then if you're a front office staff, you get that response back. Of course, you can turn to the patient. I apologize, we're about 5 minutes behind, right? Just a very quick way of staying on the same page. But we're going to say in this case, everyone's on time, ready to go. As the provider, perhaps I jump in and check some of this information. Now, I should note in this patient profile, we already have a lot of this information completed. We're in this scenario, we're saying this is an existing patient that we're going to see for a repeat audiological evaluation. If this was, of course, a brand new patient, as a front office staff, before you click the arrival notice, you'd probably double check the policy information. Typically, this is information you collect on the initial phone call with the patient. but you can always pop in here and double check, as well as add the images of the insurance cards front and back. So you can use a scanning feature, which is a direct scan feature, Snapshot, which is our mobile app for grabbing images and loading them directly in, as well as a webcam. There's also tools here for verifying the validity of this information, so you can determine on the fly whether or not, in fact, this information is valid before you provide any products or services. Right? It has a big advantage for saving you time because you're detecting issues now versus once you've submitted the claim. Okay. There's also a tool in place for recording hearing aid benefits. So if you've already made that verification call, you can see all the details here. And so take a common scenario where the patient calls in and maybe you schedule them out for a week. You go ahead and make the verification call as a front office or back office member or consultant, and you store the information here. As a provider, you could jump in and see a PDF of this. You could open it back up and look at the details directly. You also can update the hearing aid cost. So this would be possibly after you've discussed options with patients, or maybe you're prepping. You have some ideas as to what may be applicable for the patient, maybe once you finish the audio. You can update the cost here, for example, and it will update the out-of-pocket estimate for the patient. So this is a very flexible tool that you can collect information when you make the verification call, benefits verification call, and then when you actually see the patient, which could be the same day or 2 weeks down the road or 2 months down the road, you have all this information at your fingertips. Okay, so point being is you can see that directly from within the patient's profile, insurance profile screen. All right, but let's jump back to the patient administration. Now, once again, let's say the provider has been alerted, the patient's ready to be seen. You pop into this screen. Like I said, you may want to check the benefits information, probably want to glance in the previous audiogram. So I'm going to go ahead and click here on the last audiogram. If there are more than one, you can flip through. That's a little bit of an unusual audiogram. Okay, that's getting more back to what we'd expect. But you can have a quick overview of their test results over time. Okay. From there, we can say, all right, well, let's go ahead and jump to the Appointments Visits tab. Now, once again, in this case, an existing patient. So we have some records in place. You could view previous chart notes if you want to see that information quickly, or you just say, okay, I'm ready to see this patient. Let's go ahead and jump on in. All right, so in this case, we're going to go ahead and click on New Visit. This is going to take us directly to the patient visit screen. Now, once again, I'm going to stay a little higher level through these areas. But of course, there are tutorial videos which go into these areas in more detail. So we're going to go here first to the CounselEAR Insight tab. And this is a good opportunity to remind you that CounselEAR is available on any internet-enabled device. So you could be using your laptop, desktop, or as well as your tablet computer when you're going through the process with the patient. And it makes it very simple, in particular tablets, because you can just tap in the responses to the patient as you're talking with them. Of course, if you have a desktop or laptop, that's great too. It's really whatever you have convenient at the time. But the idea here is to not have to write anything down or even remember what the patient may have said. So we're going to click or tap on whatever comes up during the conversation. Now, all of these templates do come preset, but they can be fully customized. So if you said, hey, that's not really the order in which I ask my questions, or maybe I want those templates changed with different wording, I want to specify. Maybe you do different kind of subtests. Maybe you do VNGs and tinnitus evals and or speech pathology or pediatrics or APD, right? Whatever kind of different testing you want to do, we can help you build this system custom, right? So just by clicking on those areas, it's now added those options to the top of the left-hand column. This replaces the need to have to write anything down or remember what the patient may have said. At the same time, CounselEAR is building your reports, right? So as you're going on, as you're talking with the patient, it's building your professional report case history, your professional recommendations, as well as the patient report recommendations. And these can be edited on the fly as well. So you can click or tap on the text at any time and simply go ahead and add something as you go along. Now, you may be a great typer and you want to put a full phrase in place, right? Or you're like me and not. And so you want to put something simple like fact 15, which for me would represent they worked in a factory for 15 years. Because one of the key ideas with the CounselEAR Insight feature is that your focus stays on the patient. Your head is not buried in the device. You're not distracted by the device. We want you to keep that rapport. So this is very designed to be very light touch. You click or tap on the left, you update on the right, but you keep that conversation flowing with the patient. Ultimately, After the patient leaves, it's going to be very fast to clean this up and finalize the report. So what we're going to do next is, once we finish the case history portion of the evaluation with the patient, then we're going to click Export to Reports. This is an important step because it signifies the transition from the case history part to now, okay, we're moving into the testing phase. Okay? Now it's important, and I should mention, now you can see that information we just generated has already populated the case history, right? Part of the report, as well as the recommendation. So at this point, we have a substantial amount of the report already completed, and we haven't even played the first beep, right? So at this point, though, we're going to move ahead with testing. It's important to note that CounselEAR is NOAA compatible, meaning you can utilize any testing equipment that you like. If you have NOAA compatible testing equipment, that's great. You would go ahead and do your testing like normal, and at the end, you can export the test data from NOAA into CounselEAR. The reverse is also true. If you have standalone test equipment, great. You can complete your audiogram right within CounselEAR. So as you're testing the patient, you can click or tap to enter the thresholds along the way. And then, of course, you can pull that data back into NOAA once you're done testing if you want to do a demo or prep for a fitting on a different date. So the point being is, regardless of what testing equipment you have, you only ever have to enter your test data one time, either into NOAA and send it to CounselEAR, or into CounselEAR and pull it back into NOAA. Now, with the test data in place, we can bring open shadow audiograms, right? So we can see what the change is over time. I'm going to skip that wonky one because that, well, we can show it here. See, that would be you'd notice a big change there. So we're going to go through and you can see the different options, or the different results, I should say, over time. You can use that right away in counseling, or have that show up on the final report. Okay. The second thing here is CounselEAR will assist you with classifying the hearing loss. So it utilizes the AMClass system to look at the thresholds and say, all right, based on air conduction, bone conduction, this ear is sloping, mild to moderate, sensory narrow, and symmetric. Now, it's important to note that this is just a starting point. You have full ability to customize this as needed. So if you look at this and said, you know, I'd rather call this normal to moderate, or I'd rather call this flat, or mixed, or asymmetric, right? Whatever you want to set this as, perfectly fine, right? The reason that this is an important setting is it's going to save you a lot of time later on in the workflow. So for example, when you go to write the results section of your report, you don't have to type mild sloping to moderate sensory hearing loss. CounselEAR will do that for you. When you go to your coding, CounselEAR will look at the classification for each year, along with the case history you've already collected, and determine the appropriate ICD-10 codes specifically for this encounter, right? So it saves you a lot of time and effort along the way there. So it's important to get that in place. Now, as you've probably already seen, there are a whole series of subtests down below. Now, the configuration here, that's a cookied setting. So once you have that in place, it will be remembered for moving forward. Here we have tympanometry. As I mentioned, with the NOAA compatibility, you can send this data, including the temp data and reflex and decay, as well as speech, word rec, MCLs, UCS, sound field. That all can be sent over from NOAA, right? But if you have standalone equipment, you can obviously enter this information directly, including the curve. You can draw that. I'm going to go ahead and add just a little more test data here just to fill this out. And there we go. There are other tools, of course, along the way here, but we'll kind of zip through this. As I mentioned, you can enter more information for other subtests. You also can put a note right on the audiogram. This is the audiogram annotation. This enables you to put a note right on the audiogram that perhaps there's been no significant shift, or there has been a significant shift, or the patient fatigued to testing, or something like that. All right. Now, at the bottom of the screen here, we'll see these buttons. All three of them will save our work. So obviously, the one in the middle here, save, continue editing. That's a quick save, keeps us here, okay? Also, the continue main screen. When you click there, it's going to first save your work and then take you back to the main screen. So if you export the data from NOAA into CounselEAR, you looked at it, looks great, boom, click continue main screen, and you're right back here and everything is saved, okay? Now, at this point, we finished testing the patient, and now it's time to start counseling. So we're going to jump right to the patient report. You'll see the classification for the hearing loss is already in place, along with 3 recommendations that were generated during the case history part of the encounter, right, based on the patient's specific concerns. Now, you can jump in here anytime. You can type in new recommendations. You can pick from the preset list. Very, very flexible. But the point is, Within 10 to 30 seconds after you finish the patient encounter, or patient testing, I should say, we want you to be able to generate a single page counseling summary. This is the patient report. This is the tool you can use right away in counseling. You can print it, draw on it, you could show it on a screen and then email it to the patient, however it is you wish to utilize it. But the focus is to improve what patients remember and increase the likelihood they're going to follow through with your recommendations. And so we can see their info here, we can see the familiar sounds audiogram, we can see a layman's term description of the hearing loss, as well as the specific recommendations that you need the patient to understand. So these could be very specific. Maybe you saw an asymmetric hearing loss, and so you wrote, call Dr. Miller at 55555 due to difference between your ears, right? Or you scheduled their fitting. Return on Tuesday the 17th at 1 p.m. For your hearing instrument fitting. Whatever it is that you wish to put in there, it can be more general or hyper-specific. Regardless, you can create this very quickly and provide it to the patient. This is also a very powerful tool when we're talking about working with physicians, because one of the challenges, of course, that we face with physicians is that, we send reports out to them, but they don't see audiological evaluations very often. And so we're kind of expecting them to be able to read the audiogram and counsel appropriately. So the patient report is a great supplement to the profession report in that you can send this out, email or fax, along with the profession report. And one, you're showing the physician the type of counseling that you provide. You're actually showing them, right? Versus maybe telling them in a meet and greet. You're also giving them a guide, right? This is a tool they can use right away to understand this hearing loss at a much more kind of personal level, right? Language they can relate to and then use in the conversation with the patient. So not only is this tool designed to help patients out, but also to make that continuity care stronger. So physicians have a better understanding. They can, discuss this more detailed and kind of better with the patients. And of course, it improves your relationships with physicians because ultimately you're making their job easier. Okay. All right. So let's jump back to the main screen here. So now we've finished counseling the patient. We're going to move on to the next stage, which is the patient stands up and they're going to walk up to the front desk. Well, we need to get a bunch of information up to the front desk so we can determine if any dollars need to be collected now or if a claim needs to be built, those kinds of things. So we're going to go directly back to the General Information tab and select Auto Calculate Codes. This is going to cause counselor to look at across the entire encounter and say, all right, based on what we know, based on the classification of hearing loss for each year, based on the case history, great. Here are 3 applicable ICD-10 codes, right? If your case history is more complicated, if you had exostoses, if the test results were more complicated, you had mixed hearing loss in the right and conductive in the left, counselor will detect those related codes, and of course these codes are all kept up to date. Okay, same thing goes for the CPT, the procedure codes. Counselor looks at the specific tests that were performed and helps determine the specific codes. Now, it's important to note these codes can be edited anytime, right, on the fly. We also can assist you with kind of auto-populating codes. If there's specific things that you need to pop up in specific scenarios, we can assist with that as well. Now, Counselor also has the MIPS system built in. MIPS is a voluntary system, so you may not be doing this currently, but perhaps will in the future. But if MIPS ever comes into play, just keep in the back of your mind, the system is built in place. It guides you in which measures are appropriate, which codes apply, and then those codes are immediately put on, or I should say, when you create the claim, are appropriately put on the claim automatically. Okay, so now we're going to go down to the main part here, the superbill. This is the information we really need to convey to the front office manager. So I'm going to go ahead here and click on Edit Superbill. We can see there are the 2 services, audio and temps. Based on the data we had, it drove those codes and added these to the superbill. Now we could add modifiers on the fly. We could look up our modifiers. We could add more, of course, to this. So we can say, hey, let's go ahead and add a box of batteries. Okay. So now we have 2 items that'll go in the claim. The third will be private pay. Okay, so we have our superbill done. Now we need to let the front office manager know that, right? So what we're going to do is we're going to send a chat message up to the front desk. And it automatically populates that the bill for LA, for Laura Arthur, has been completed, ready for invoicing. And I'm going to say also, give box, was it 13? Okay, really simple message, right? You can come up with your own shorthand. And that's going to send the message up to, in this case with Linda, letting her know that the superbill is ready to be invoiced. You could also put something like next appointment, schedule next appointment for, fitting for 1 week or something, right? Whatever you need to convey. So at this point, as the provider, you have now done everything you need to do regarding coding and reimbursement. That's now been sent up to the front desk for the invoice to be created. So you could then proceed with finalizing your professional report or writing your chart notes or maybe taking next patient, whatever the case may be. And we're going to come back to finalizing this report in just a moment here. What I want to do is kind of walk this through with the rest of the workflow with the patient and then come back to the report writing. So now we're going to imagine the patient's up at the front desk. Linda gets that pop-up, she clicks the pop-up, it immediately takes her back to this screen. So she knows the exact visit where we need to generate an invoice, okay? All she has to do is click actions and then new invoice. This is gonna take all the decisions the provider made and it's gonna pull them over into the invoice. So here we can see there are 3 items, 2 that'll go on the claim and 1 that'll be private pay, right? So just like that, no duplicate entry, you just simply pull it over. Now you can add more to the invoice at this point. So if the patient got to the front desk and said, oh, you know what, I need some wax guards, no problem. You can go and add them right here at this point. You do not need to go back to the superbill. You would simply just add on the fly here, okay? But let's just say we're all set for now, so we're gonna move on to payments. What CounselEAR then does is it splits this out. So it says, okay, hey, are there any components of this that should be private pay? Now, I want to also note that as part of this process, you can have some automatic features happen behind the scenes, meaning that if the patient, let's say, is in a service plan, right? They've purchased a service plan or it's included as part of their fitting fee, discounts can automatically apply. So what happened in this case was, because this patient has active devices, it took that $40-some battery charge and took it down to 0, or it could have applied a 10% discount or whatever the case may be. So what we see here is that it automatically wrote it down, right? That's a really nice time saver and also just a really great way of keeping track of this information so you don't inadvertently charge a patient when they shouldn't be charged, or you apply a discount when it didn't apply. So that can be built in behind the scenes related to basically very specific how you want certain products and services to behave if the patient is within a service warranty. Okay, so I'm going to go really quickly here and actually add something else just to so we can take a payment quickly. All right, so we're going to just grab something quickly here and say the patient needs some domes. Okay, $4. Maybe we're going to do 2 of those. Okay, tax will automatically apply if it is applicable. So now we can see we have the domes there, and then we jump to the payments tab, and what we can see here is has the total amount due, the patient due, as well as the insurance due. So at this point, we're just going to take the patient due. So we're going to say, all right, this is private pay. CounselEAR does have integrated credit card processing, so you could take it right there. But we're going to go ahead and say we'll just take this as a cash payment. Okay, and then we can apply this to a specific line item. So we're going to say, all right, this $8.67 goes directly to those domes. Okay, just like that, we've taken the payment. We now have, we now have, we can see that the patient due is now 0. This may change once the insurance claim goes through the process. There may be some patient due, but as it stands, that's 0. Okay. If you want, you can create a statement for the patient straight away. If the patient has an email address in place, you also can email that to them. So at this point, though, you've now taken that payment. The patient walks the door. We can move on to the claims tab. Now, you could hold off on this. You could say, hey, I don't want to do the claim right now. I'll save it for later. CounselEAR has a tool, specifically the appointment lifecycle summary, that enables you to detect any claims that still need to be created and submitted. Right, so you can leave this and come back to it later, or of course you can just say, great, let's start a new claim. Now what we're going to see is that CounselEAR just loads the patient's contact information in, right? Nothing you have to enter. This is really just a review process. We can see their insurance information. We can see diagnosis information, right? If a referring physician was noted, billing information, this all auto-populates, right? So you're not having to automatically to directly put this in. We can see the audio, we can see the temps. Now you'll notice there's not a line in here for the batteries because those are, I'm sorry, for the domes because, or batteries or domes I should say, because those were private pay, okay? As we move forward, we get to the final step, and then we can submit this claim directly to the clearinghouse. In this case, I'm going to submit it to ClaimMD. CounselEAR will run a scrub of the claim and then send it directly to the clearinghouse, right? So just like that, it passed the scrub, the claim is now out the door, okay? With that said, I mentioned Counselor integrates directly ClaimMD and Apex EDI. You can work with any clearinghouse that you like because Counselor does create the claim files, both the 1500, the HIC for 1500, CMS HIC 1500, as well as the 837P files that you could load to a different clearinghouse. Now, it's important to note that Counselor sends out the 837P to clearinghouse because it's far superior to the 1500. It speeds up claims, it reduces errors. So that's the actual file that's going out, and we recommend that's the file you use if you're loading it to a different clearinghouse other than ClaimMD or Apex. Okay, so at this point, we've now gone through the workflow of this patient, scheduling their appointment, we reviewed their profile, we've created the evaluation, we've created the superbill invoice and submitted a claim. Let's loop back here quickly, back into this visit and show the process for finalizing this report and sending it out. Okay, so once again, as a provider, I have now sent the chat message regarding the superbill up to the front desk, and I think, you know what, I want to get this report done right away before I see my next patient, right? Let's get this done. So we're going to jump into the profession report. You can see we already have a lot done. So we're going to jump into history and very simply just fill this out, right? Whatever needs to be kind of clarified, we'll just say here, factory for 15 years, and that's likely it. Now, maybe you want to import more. Of course, there are templates you can choose from. These are all customizable, of course. In particular, maybe something came up later on. Maybe you asked them later about all fullness, so you add that in, right? Just by clicking on it, it adds the text, okay? We then go ahead and say, all right, we've got what we need there, so now we're going to move on to results. The idea here, once again, is to minimize any typing. So we're going to grab, in this case, a composite template where it's going to show otoscopy, TIMPs, pure tones, word recognition. And in this one, you see the yellow highlighted area. These are called placeholders. Whenever you see the yellow highlighted area, it means you don't have to do a thing. It means Counselor will fill this information for you automatically, okay, based on other information in the system. So these placeholders also work, of course, for patient name and date of birth and pronouns and last test date and specific test data if you want to insert the word rec scores, for example. There are tons and tons of different placeholders that can autofill, and we can help you get your templates in place. So in this case, this is a relatively short phrase, but likely hopefully covers what you need. If you're looking at APD reports or speech pathology or tinnitus or vestibular, and you're saying, gosh, my reports are a lot longer than that, we can assist you with creating new templates custom for you that with a single click will put in all your preferred text and will have as many placeholders as possible. And those custom templates can even include tables, right? So we can really assist you with making this process very streamlined. And so then you're moving right on to recommendations. Recommendations, we can go ahead and click on whatever we need to add. So we'll say follow up with the referring physician, maybe utilizing strategies for improving speech understanding, for example, or trial with amplification, whatever it is we want. You can type in whatever you want at this point as well. So we add our recommendations. If they're out of order at this point, that's perfectly fine because back in the main screen, we have the ability to reorder these. So maybe I want to move that referring physician back to the top of the list, and we'll put the trial with amplification as second, for example, right? And maybe I want to remove something, right? You can just go ahead and delete that on the fly. Okay. Now you'll see that currently it does not have a physician list, and that's because we haven't selected the referring physician yet. You can add a referring physician or facility to this report. You also can add as many additional recipients as you want. So maybe you need to send this report out to multiple people. You can add as many as you like, and they're each going to receive their own version of the report. Okay, so in this case, I'm going to go ahead, click Edit Referral, and I'm going to go ahead and just pick Dr. Baldwin here. Okay, that's going to fill in all Dr. Baldwin's information, right? This is all preset behind the scenes. And so you can zip through and say, okay, what language do I want on my fax cover sheet? Do I want a cover letter? Let's say yes. What language do I want? Do I want a med clearance form? Let's say yes. What language should I have, right? And just by those steps, you've now created your fax cover sheet, your cover letter, and your med clearance form. Really simple, really smooth. Now we can jump in and see the report that specifically will be sent to Dr. Baldwin, right? So when we click here on the PDF icon, it'll bring up the report. Now I should note that this would have your logo and your information, of course. But we can see the fax cover sheet. We can see the cover letter. We can see the med clearance form. And last not least, we can see the official report. Okay? And then once again, the idea here is to get you to this point as quickly and as accurately as possible. There's other things you can do as well. You can add attachments to this. You could redefine or refine the look and feel of the report. If you don't want the audiogram on there, maybe you want to change the order of the report. You can set predetermined layouts. So if you say, hey, this is a PEDS patient, you could select that and it will reconfigure your whole report. So very easy to get that in place. If you do make any changes here, go ahead and click save, and that will lock in those changes. Okay, but at this point we're saying, hey, we have our report ready to go. Let's get this sent out. I can hear the patient in the waiting room. Let's go here to send reports. This is the area where you can see any recipients that you list. In this case, we can see Dr. Baldwin. We also see the patient. If we had multiple, additional recipients, we'd see them all listed here. So we're going to say all right, we're going to send both the professional report and patient report to Dr. Baldwin. It's noted in his profile that he prefers that we send via fax. So CounselEAR automatically set this to fax and filled in the physician's fax number or facility or any healthcare provider, right? So all we have to do is click send. That's going to take those reports and fax them directly out to the provider. It also will track that fax. So if the fax fails, CounselEAR will keep trying over the course of an hour. So repeatedly over the course of an hour. If it continues to fail after an hour, you'll get an email letting you know the fax failed. There's also the ability within the visit itself to track this so you can see what's happened for a specific fax. Even 2 months, 2 years down the road, you can see what happened with a specific fax attempt, attempted send. Okay. So that covers the process of finalizing and sending out the professional report. So hopefully at this point, you've kind of wrapped up the majority of work, except you may want to add in a quick chart note, of course. So at any point, you can jump in here, you click Edit Notes, you can type in, you can voice dictate if you're using a voice dictation system, or of course, you can use the preset templates here below. So in that case, you would simply just click on whatever it is you wish to add, and it will add that text on the fly. Okay, as I mentioned repeatedly here, there's a lot of detail to individual components of this workflow, but I wanted to give you an overview of a typical patient encounter and some of the various steps that are involved. So if you have any questions about the details of this, please reach out to our support team. We'd be very happy to review this with you directly, as well as review the additional tutorial videos which get into individual segments in greater detail. So thank you very much for joining us for the CounselEAR Workflow Overview tutorial.